To this morning, the country's child mental health services are in crisis, and this is according to the 2022 SA Child Gauge on child and adolescent mental health. It found with an increase, in risks due to COVID-19, more investment is currently needed. Now, as we mark World Mental Health Day, let's speak to the report's lead editor, Professor Tomlinson, who joins me this morning to take this conversation forward. Prof, thank you for your time and good morning to you. One would wonder why this increase we're seeing in mental health issues amongst younger children. I think oftentimes, we think it's only the adolescents, the teenagers, or perhaps even the young adults and the adults that we could see mental health issues with. But you're seeing a much younger age here impacted. Good morning. Take me through the data.
Morning, and thanks for the opportunity. I'm absolutely right. I mean, I think one of the reasons is that, or there are a whole lot of reasons why children, even younger children, are affected quite severely by something like COVID. So, for example, one of the things, as we all remember, was, long periods of lockdown, school closures, and for young children, even very young children at preschool age, engaging with peers, playing are key aspects of their lives. They also were watching as anxieties generally went up. In many cases, there are figures of up to 60 to 70,000 children in South Africa have been orphaned by COVID. So again, you have a whole range of ages of children that were very severely affected by deaths of loved ones, a country in heightened anxiety, school closures, lack of opportunities for interactions with their peers. And then very, very importantly, we know there's a very strong relationship between increasing poverty and mental health struggles. And so we know as a result of COVID, many people are much poorer as a result.
Absolutely. Now, we know that oftentimes young adults, teenagers are often encouraged to speak up, to express themselves. Find somebody you trust. Find a professional that you can speak to. Call a hotline. I just wonder if children that age are able to express how they feel, to actually, express exactly what they're going through so they can find the help that they need. How do you then, as a caregiver, see or spot if a young child actually has a mental illness?
Well, I mean, very, very good question. One of the things we tried to do in the Child Gauge was to really think about these issues as lying on a continuum. It's not suddenly that there's this, enormous group of children that have got, for example, a diagnosable mental illness. That's not what we're thinking about. I mean, of course there are. But that people start with, children start with small worries, small anxieties. And at that level, institutions like the family is utterly key, is an awareness, watching if your child is struggling with school in a way they didn't before. They're refusing to go to school in a way that they didn't before. So these are early signs, not necessarily of mental illness, but just of a struggle and the extent to which a family can be available. And then schools also are incredibly important site, a platform for us to watch where children are, for example, starting to truant, not arrive at school. Teachers are often very trusted people, particularly in adolescents and young children's lives. And so that's also a really important place in which, we can pick up the early signs. And in the early stages, it's often just support from the family and support from loved ones that really is key and can make a massive difference. Yeah. And it's not just about that far end of where there's actually a mental illness, for example.
Absolutely. And I see actually that you are doing something about this as well. Let's talk mental health. I mean, this is part of your social media campaign as well, to get, the country, the world, everyone virtually talking about mental health, with the hope that it goes to our nuclear families where we can, during dinner table, check in on each other, parent, child, everyone can talk. I mean, I suppose that could be a way to start. But for families that perhaps may still, have sort of an experience with stigma about mental health, how do we start that conversation? How do we almost simplify mental health to children and say, listen, if you are concerned about something, like you said, have small worries, you can talk to me about it. How do you suggest we start those conversations?
Yeah, I mean, that's again a very good question. I mean, I think it's a lot of it. You talk about parents and caregivers and loved ones, because for many children, parents in the broader sense of the word, because sometimes that's an aunt, an uncle, sometimes even an older sibling. So the first thing is that for us to kind of that all children need somebody in their lives that sort of absolutely adores them and knows them. Because what often what happens, the early signs of a struggle is that the child, a young child particularly, may not even be aware that they're struggling with something, but their behavior starts changing. So if there's an older adult who kind of knows them very well, and is vigilant, not as in like searching for something, but like just is monitoring and knows them, that they will pick up the early signs. And we know that early intervention is absolutely key. You don't want these problems to build and snowball, as it were. So having trusted, caring people in their lives who actually know them and can see a difference is key. And you're absolutely right. I mean, your mental illness, for example, is massively stigmatized. And so I think we need that. That's not something that a family can solve. That's that's a whole series of things we need to do to make it easier to talk about mental illness. But for families, for schools, it's a sort of a realization that people right now are stressed, are struggling, whether it's from COVID. Young children are increasingly worried about what's happening with the climate. There's a lot of worries. So support from loved ones, caregivers, of the kind of sort of that not so much the nuclear family only, but also communities, is actually the first step.
And I appreciate you speaking to us about this. Thank you so much, Professor Mark Tomlinson, for making time for us right here on the South African Morning, lead editor of the 2022 South African Child Gauge on child and adolescent mental health. Let's normalize having those conversations in our households, at schools, in our communities, at church, with our colleagues. They, as an institute as well, have started a campaign on social media. Let's talk mental health. And they're saying be a part of the conversation, and they could trickle down to your closer circles. Thank you so much to the good prof for speaking.